Obesity is one of the major epidemics of our time, and it can cause a whole host of conditions that can threaten our health. Our weight affects our heart, our blood pressure, and the likelihood of having a stroke, diabetes, or inflammation. Excess weight also has a direct impact on our ability to breathe, and it presents a higher risk of developing chronic obstructive pulmonary disease. Nobody knows that better than Ed Neuzil, board-certified advanced practice registered nurse at Allergy Sinus and Asthma Family Health Center. He's been helping patients in the Villages breathe easier for over 20 years.
Nobody wants to have COPD, but the more they can understand about this disease, even before they have it, the more we can prevent the disease. COPD is actually a chronic obstructive pulmonary disease. So this is something that goes over a period of time, and it can include things like asthma, chronic bronchitis, emphysema. So it's kind of a cover term in the fact that a person's airway does not actually return to a normal state after we give them a bronchodilator. A lot of times people don't understand. They think that what they have is normal. I talk with my patients and ask them if they're short of breath. Do you do anything to get short of breath? Well, no, not really. Did you ever do anything, activities? Well, I used to play baseball, but I don't do it anymore. Well, why not? I just didn't enjoy it. Well, you know, if you played baseball and you got short of breath every time you played baseball, you ain't gonna play baseball no more, because we as a people have a tendency to do what we like and makes us feel good and not do the things that make us feel bad. And they don't understand the fact that this may be a change in their health. If you presented the way you are now like you were 20 years ago, you'd probably be in the hospital swearing you're dying, because you just got used to it over the last 20 years. And we just get used to the various changes in our life. We have a lot of people that maybe start to read a lot more, or they spend more time on the computer. We have a tendency to get together and food becomes a big part of it. And so we have a tendency to eat a lot more than we ever have. And I have had many patients gain significant amount of weight, and the more weight they gained, then the more short of breath. And they started to limit the things they do. So as we become more social and we're eating more, we should be exercising more. And I tell a lot of my patients that if you want to get off some of your medications, then let's get some exercise. The more exercise you do, the more healthier we become, the less we need medications to compensate for some of the things we see.
To get in touch with Ed Neuzil and the staff at the Allergy Sinus and Asthma Family Health Center, please visit our specialist directory. Just click the COPD and your weight story link icon on our homepage at yourhometownhealth.com.